In the past, our back and neck pain expert, Dr. Christopher Miller, has given us lots of helpful tips on how to prevent injuries at home, as well as how to relieve chronic back and neck pain.
And today he's here along with two of his patients to discuss some alternate options for those of you who are suffering but maybe don't want to undergo risky surgery.
So let's say hello again to Dr. Miller and meet Norman Shabinsky and Dean Morgan. But first, we're going to talk to Dr. Miller. You really have a lot of people come to you and seek of some relief for different symptoms. What are they?
Absolutely. General neck aches, back aches, headaches, acute injuries, and I think what we're really known for around town is degenerative spinal conditions that really are chronic and affect people's lives in many ways. So we're talking about degenerative disc disease, bulging discs or herniated discs, sciatica, the shooting pain in the arms or legs. Maybe they've even had surgery already and it didn't work, or it just didn't last, and they really want to work on getting their problem fixed. Those are the kind of things we can help with.
So your patients here today have two very different stories. They're in different stages of life. Norm was probably a little more like one of your typical patients in that he's had some conditions that have deteriorated through the years.
Right, a lot of degeneration in his spine, and I think he had some leg issues going on and back issues, and just had a tough time walking and getting around, and you know, like he said earlier, it just really wasn't given much hope. And you know, we took a look at what the issue was and made sure we knew what we were dealing with, and felt we were able to help him out, and it's working great for him.
So Norm, you said that you had a problem walking.
Very
Can you
definitely.
elaborate about how difficult that was? I would imagine that would keep you from doing a lot of things.
It stopped me from doing fishing, gardening, any yard work or anything else. I couldn't walk across this room without being in pain. I'd have to stop partway across and then just pause for a minute until the pain would go away a little bit and walk a little further. If I had to go to the grocery store, I always made sure I had a little cart in front of me, and I'd walk a little ways and make like I was shopping, and then move on a little bit further. And what I found going to Dr. Miller, after going to other chiropractors and getting no relief, he pointed out what the problems were. He showed me on the x-rays. He gave me specific things and areas that were causing my problems. The discs were degenerating, and they were almost paper thin. The arthritis that was in there was almost causing the vertebrae to close together. And fortunately, I got to his group in time, and they put me back on the road. I can now walk once again, and I haven't completed the program yet, but right now I'm 200% better than I was when I walked through that door.
Well, and the technique that you use that is unique to your practice is the DRX 9000, which really allows you to specifically treat this kind of chronic pain condition. Just briefly outline that for us, Dr. Miller.
Well, what this machine does is very specifically target individual discs. So if they're degenerated or bulging or herniated, the machine gently pulls the bone above and below apart to create a negative pressure on the disc and relieve pressure on the nerves. And it can actually retract those herniations back in off of the nerves. So we're really trying to fix the problem, not just mask the pain. And the most unique thing about this is that it interacts with the patient. If they start to spasm or resist, it will back off and allow them to relax. So it's not just ripping them in half. It's very interactive during the treatment. It's very comfortable. You can see that woman just relaxing very comfortably during the treatment.
And then it helps the body heal itself then.
Exactly.
Wow.
Yeah.
So Dean, you were involved in a workplace accident. Why don't you tell us about the pain that brought you to Dr. Miller?
Oh, the pain pretty much limited and controlled my life. I didn't have control of my life, the pain did. And at the time, I really didn't have much hope for a good outcome. And actually, my mom had seen you guys on 8 West and suggested trying Dr. Miller's office out, and they greeted me at the door with a smile, offered us refreshments, munchies, and signed in. Nice. Was treated with traction and chiropractic care by Dr. Joel, in and out in 15, 20 minutes. I've never been in there more than 15 minutes.
And you're a young guy, and you were doing some specialized work out in the oil fields of North Dakota. Tell us a little bit about that.
Well, I was crushed, and what happened is I ended up with 9 bulge discs. 2 of them are tore, a pars fracture at my L5-S1, which caused grade 1 spondylolisthesis, and my right knee got screwed up. And the amount of pain that I was on out there, they had me on over 4,000 milligrams a day in meds. Since seeing Dr. Miller, I'm down to under 100.
Wow.
That's amazing. And I know that Norm had mentioned, you know, the medicine. Talk about surgery and talk about medications that you get. Both of you have expressed that that was a really big concern. You were seeking a treatment that didn't involve pain meds.
Yes.
Why is that?
Well, the pain meds kind of alter you. They turn you into a different person. They make you bloated, uncomfortable, irritable. My wife can attest to that one. And they just, you're not the same person on it. And less meds means more you.
You know, Dr. Miller, what I love about your office and really getting to know you over the past couple of years here on 8 West is that these guys are two examples that are sitting before us, but your office is filled with hundreds and hundreds and hundreds of people whose lives basically have been restored to normal because of the treatments that you offer.
Well, it's always exciting, and I gotta say I'm real proud of these guys because they've done everything we've asked, and they're just doing fantastic. And you know, the viewers can't see what they look like before, but both look like totally different people, and their whole attitude about life has totally changed. So it's just really exciting to see those changes happen.
All right, so you've got a great opportunity for 8 West viewers if they see this. A couple of them, actually. What are they, Dr. Miller?
Well, first of all, if you call today, we're going to offer a $39 special, so you can come in, and for $39 we'll do the exam and determine what the problem is. And then we have a special for the first 8 callers. We're also going to include a 15-minute chair massage with one of our massage therapists, so that's a great deal for them. And
It's a little extra nice.
it's always good to have that in the summer. So.
Yeah, it is really nice. So we so much thank you for being here with us today, Dr. Miller, Dean, Norm. We really appreciate your being willing to share this because, as you mentioned, it was because other people had seen other guests on 8 West who had found some great relief with Dr. Miller.
Thanks for having us.
Yeah.
Thank you.
We'll be right back.
This is 8 West.